Hi, my name is Dr. Craig Silverstein. I'm the owner of Family Chiropractic Works. I opened this practice back in 2001. When I was 18 and I was in college, I was at Rutgers University studying pre-med, and I worked as an auto mechanic, actually doing batteries and tires and just little stuff. I always loved working on cars, and I seriously hurt my back. I felt something twist, and I couldn't even get up. This has never happened to me before. I played high school football, I played hockey, I played full contact sports my whole life. I have fallen off of houses. I've never gotten hurt. This was a pain that I could not explain to anybody. It hurt so much, it hurt to breathe. The next day was even worse. Like, I didn't think it could get worse. The next day was worse. I could not get off the couch. I could barely move my legs. And here I am, 18 years old, exercised my whole life, fit and trim, strong as an ox, and I literally am crawling to the bathroom. I went to quite a few orthopedists. I had 3 MRIs and I believe a CT scan. Nobody gave me any answers, but one orthopedist told me, he said, "It looks like you slipped a disc." I said, all right, that sounds bad. I've heard about these disc problems before. This is bad. I was put on medication and they told me that eventually I'll have to do some physical therapy. I spent 3 weeks on the couch. I went back to work light duty, and it was my boss at work who kind of was busting my chops, and he said, listen, I need you doing your normal job. You walking around holding a clipboard taking notes, you're not helping us here. Have you gone to a chiropractor? I said, nah, I'm not going to a chiropractor. And he goes, why not? He goes, I go to a chiropractor every week. I said, nah, they're not even real doctors. I'm studying to be a real doctor. I'm studying to be an orthopedic surgeon. And he said, but you're 18 years old, you're fit and trim, you've been on the couch for 3 weeks. What have you got to lose? So he gave me the name of his chiropractor. I didn't give it really a second thought, but later on that evening, I remember, again, sitting on the couch, I'm taking my medicine. I'm taking enough medicine to probably knock out a horse. And I realized he's kind of got a point. I don't really have an answer as to what exactly happened to me. I'm not getting better. I called his chiropractor the following day. He did an exam, a very brief exam on me. In fact, the doctors in the hospital, they did a much more comprehensive exam on me, but he did a very brief exam and he said, I need to take a couple x-rays. And I admit I was kind of pompous. And I said, what do you mean x-rays? I have 3 different MRIs, I've had CT scans, and I've been to 3 orthopedists. And he said, just let me take a cheap old x-ray. So he takes an x-ray and he doesn't even have a light box. He holds it up to a fluorescent light. And he says, oh, I see what you did. All right, lay down on your left side. I said, well, what are you gonna do? And he's like, what does it matter what I'm gonna do? Just lay on your left side. There's a bone that shifted. I need to shift it back. You're not gonna get better until I shift it back. I said, oh, listen, I don't think there's a bone that shifted. I mean, I've had 3 MRIs, I've had CT scans, I've been on 7 different medications. I've already seen 3 orthopedists. Wouldn't they have seen the bone that shifted? And he says, no. Different professionals look for different things. So I laid on my left side and he applied some pressure, and then all of a sudden, and I thought my spine just snapped. I didn't know, I thought I was in a movie, like I'm not gonna be able to move my toes now, and here comes a wheelchair. I mean, I really had bad thoughts about it. He says, all right, take your time and come on, get up. Well, I was able to sit up, and I'm like, okay, I mean, everything's moving good. I stood up and I was 80% better in 20 seconds. Like a reality changed at that moment. And I realized what I thought were the best of the best and all these advanced images and this and that, it was actually something, I'm not gonna say it was simple, but it was something that was simpler. And I said to the chiropractor at this time, I said, how did you know to do that? And how did you know to do it in that direction, in that location? And I said, you know what, can I work here? And I started working there. I didn't get paid, but I worked about 20 hours a week with him. and I would converse with his patients, I was intrigued. Here I am, I'm studying to be an orthopedic surgeon. I am studying to learn how to put things back together, whether it be by surgery or screws or plates, how to identify and diagnose proper alignments, misalignments, but yet everything that this guy is doing, I have no idea what he's doing. I've never learned this, I've never seen this before. So I worked with him for about 6 months. And then I decided, you know what, I'm changing course in life here. I want to become a chiropractor. This makes more sense. I think that I can dramatically help people in a different way that's extremely effective.